Welcome back, our dear viewers. President Abdel Fattah al-Sisi instructed Long Live Egypt Fund to allocate £1 billion to support an initiative for ending the waiting list of the critical cases. Presidential spokesman Ahmed Fahmy said that the presidential directives came within the state's keenness on providing health services for all citizens. To shed more light on the issue, we are very much delighted to be joined over the phone by Dr. Helmi, former Minister of Health. Good morning, Doctor.
Good morning. How are you?
How are you, sir?
Much welcome.
Dr. Helmi, how do you see the importance of such a move and directives by President al-Sisi to instruct Long Live Egypt Fund to allocate £1 billion to support the initiative for ending the waiting list of the critical cases?
This is an excellent thing that we need it badly. And from the exact description of this issue, it's for the critical cases and not the waiting list of the cold cases. In medicine, there are cold cases. The patient can wait a week, a month, a few months until receive the treatment or the surgery that's needed. But the most important for the humans is the critical cases when the disease or the injury or any illness will attack the citizen at once and suddenly, and this is the big issue for the cold cases in the whole world and in the most rich countries where they do medical insurance. People wait until they get their treatment for a few months, some months, maybe a year or less. In most of the countries, Canada, UK, and those countries. In Egypt, we have shortened this period before the initiative that has been given a few years ago for the whole case. And this was a very good thing that finished the waiting list of the patients who need cardiac surgery or some important surgery. Now, with the critical medicine, this is very important. The dignity of the citizen is affected by having sudden death, sudden illness, sudden accident, and cannot afford the treatment or the places are not available. And you have shortage in Egypt in the ICU units and the incubators of the infants and the young children. Those are two things that we have major what we will need to increase the capacity of those units.
Yes.
That's why I'm asking the health authorities nowadays to use this billion pounds in enforcing the ICU units and the incubators. I do remember in my time in the ministry
yes.
I introduced something called the hotline 137 for the citizens to use who are searching or looking for ICU unit or incubator for children in the emergency cases. And this line is still functioning until now, and it covers the whole for Egypt. And communicate with the citizens to tell them go there or come here according to the facilities. I guess that we should be wise enough to use this gift and this new amount of money to enforce the capacity of those units in the beginning, because this is the most critical minute in the life of the people. Thanks for this initiative, and my advice is to use it in a wise manner, increase the capacity, pay for the current expenses, and not only to give it as for the people who are offering the treatment, not only expenses for them, but for sure to the infrastructure of the units, which we need to enforce a lot in my country, in this country.
Indeed. Dr. Helmi, also we have to mention here that the state is showing great keenness to launch many initiatives concerning the health sector. We have seen before a very successful initiative which was concerning the elimination of virus C, as well as the health of women, the 100 million health initiative. How do you see the importance of such initiatives, and what more do we expect to see and we want to see to improve the health sector in Egypt?
Well, the importance of such an issue, we need it. We need this, and we deserve this. Our people deserve this. Our people suffered a lot from the lack of essential medical services. If we remember the days of the virus C, and which was the common disease among Egyptians, we were number one in the world in the infection rate, and it was a deadly disease at the end and decapitating as well. At the minute the world discovered a sort of drug that can eliminate the virus and get rid of the virus. Egypt was the first country to ask for this medicine, and by this initiative, the authorities could produce the medicine inside Egypt, and even we could have a surplus of this medicine to give it to other countries, African countries, and so on. And for the Egyptians, it was a wonderful campaign, an unbelievable campaign that has been done by the health authorities, the doctors and nurses and everything to treat approached 8 million persons in a very reasonable time to get rid of the virus. This was like a miracle before, and it reminds me with what the Egyptians could do in the 1973 from crossing the Barley Fall during the war with Israel. This was again another cause to a new life and healthy life for the Egyptians.
Yes. Sir, as you have kindly mentioned as well, that we need more concerning the hospital beds and the ICU beds in particular. What more do we expect to witness concerning these very important things concerning the health sector and the improvement of and care for the health of the Egyptian citizen as well?
I'm still expecting, as we knew yesterday, for this initiative and this amount of money that has been given to health authorities. I'm waiting for the health authorities to declare which items they will be spent, and the timetable and the priority of necessary things to be to get by. I need to enforce the infrastructure of the hospitals and the health units, which are covering Egypt. You know, in Egypt, we have a health unit everywhere in this country, and the capitals of governorates and the cities and the governorates of the villages. Everywhere we have the health. The Ministry of Health has a building, a unit, and working. People are working there. I need to enforce those places all over the almost more than 4,000 villages in the country, and this 27 governors to enforce this equally. And we need to know the timetable. We need to know where this money will be spent to get so and so and so in the very near future. I'm expecting this. I'm waiting for it.
Yes. Dr. Helmi, this initiative is covering all the Egyptian governorates, the people who are in critical health cases in Upper Egypt, in all the Egyptian governorates, right?
Yes, yes. And I mean critical means critical. Well, this money should not go to the cold cases. It's for the critical illnesses, accidents, emergencies, heart attacks, brain attacks, whatever strokes that might happen to the people. Accidents, this will need critical care. Critical medicine and critical care is the most difficult thing in practicing medicine and most expensive, and that's for which this money should be affiliated.
Yes, so there is a system here in order to allocate this money for the cases really in need of this direct and quick interference.
Yes, I guess there is a list of needs that has been given to the authorities and to reaches the president and could allocate this money for. So we need to declare this. The president declared the amount of money. The health authorities would be nice if they can declare for the people that in which items this money will be spent.
Indeed,
in details,
yes.
in details, and only for the critical cases and the things that would keep first the dignity of the citizen and will keep the lives and save lives of many of the citizens.
Indeed. Dr. Amr Helmi, former Minister of Health, thank you so much for your precious input and for being our guest for today. And that was our segment about the President's instruction for Long Live Egypt Fund to allocate £1 billion to support the initiative for ending the waiting list of the critical cases. Our dear viewers will go to a short break, and after that we'll be back to continue our segments in The Breakfast Show, so stay tuned.